The soleus attaches from the posterior tibia at the soleal line of the tibia and also the posterior fibula at the head and proximal third of the fibula. And then it inserts into the posterior surface of the calcaneus via the calcaneal tendon or the Achilles tendon. And because it crosses the ankle, we Hey everyone, thanks for tuning in. Steven here with Team U4, and this week's YouTube shorts are dedicated to the soleus muscle. The soleus is one of your calf muscles, and it's the deepest of your calf muscles. It's also a postural muscle, and one of its responsibilities is going to be stabilization of the ankle, which makes it a very important muscle, especially in managing something like foot and ankle pain. It's often going to be very, very weak in a lot of people, so you would want to perform some strengthening exercises for it. For the soleus, there are only 3 bones that we need to be covering, and that is going to be the tibia, the fibula, and the calcaneus. The tibia, that is going to be the most medial of your lower leg bones, and it's often referred to as your shin bone. This right over here is your tibia. We have the posterior surface right over here on the backside, and then right over here, if you can see it, that is the soleal line. Then, just lateral to that on the outside, we have the fibula, and at the fibula right over here, we have the head of the fibula. And over here, we have the posterior surface and the proximal surface closer to the top portion of the fibula. And that's it in terms of the tibia and fibula. Then if we go further down to the foot, right over here is the calcaneal bone, or the calcaneus, or your heel bone. And those are pretty much the only important bony landmarks when discussing the soleus. The soleus attaches from the posterior tibia at the soleal line of the tibia and also the posterior fibula at the head and proximal third of the fibula. And then it inserts into the posterior surface of the calcaneus via the calcaneal tendon or the Achilles tendon. And because it crosses the ankle, we know it's going to have an action at the ankle. At the ankle, its main action is going to be plantar flexion or pointing the toes down toward the floor. And then as a secondary action, it's also going to be responsible for inversion or pointing the sole of the foot in toward the midline. But those are the main actions for the soleus muscle. The soleus is innervated by the tibial nerve, and more specifically your S1 and S2 nerve roots. I'm just going to go ahead and remove part of the sacrum so you can see. Right over here we have your S1 and S2 nerve roots, and the reason that's going to be very important is because if we have any type of damage or compression to the nerve roots in those areas, then the nerves are not going to be able to send the proper signal to the soleus to fire properly, and that's going to limit blood flow and oxygen in the area, which can lead to things like foot and ankle pain. So what you can do to address that would be to do some ELDOA exercises. The reason the ELDOAs are going to be so great is because the whole purpose of an ELDOA is to create space within a joint. So if we create space within the joint, we can improve the function of the nerves, and then the nerves are going to be able to send the proper signal to the soleus to fire properly, and that can improve blood flow and oxygen in that area, which can help to mitigate some of the foot and ankle pain that you may be experiencing. Today I'm going to be taking you through some strengthening exercises for the soleus muscle, and I'm going to be taking you through 2 different variations. For both of the strengthening exercises, you want to start by going ahead and bending the knee. From this position, if we want to target the medial fibers, what we're going to do is go into medial rotation of the tibia, and we're going to do that by pointing the toes in toward the inside, and we want to create a valgus force at the ankle. You're going to do that by driving the lateral malleolus in toward the inside. Imagine you're trying to flatten the medial arch. Then the principle of action, what we want to do is go ahead and go into plantar flexion by going up onto the toes, and this is for the medial fibers. Then, if we want to target the lateral fibers, we're going to do the opposite. We're going to go into lateral rotation by pointing the toes out to the side, and we're going to create a varus force at the ankle by driving the lateral malleolus out toward the outside. Or imagine you're trying to lift the medial arch. And then, principle of action, same thing, we're going to go into plantar flexion. But those are the strengthening exercises for the soleus muscle. Today, I'm going to take you through a myofascial stretching exercise for the soleus muscle. For the stretch, we're going to go ahead and get into a half knee leg position, so as though you're in the bottom position of a lunge. The leg gets forward, that's going to be the soleus muscle that we are stretching. And what we want to do is go ahead and get into dorsiflexion of the ankle. We're going to do that by elevating the toes, and we're going to do that by placing some type of surface underneath it. I have this hook right over here. You could use a wobble board, you could use an incline board, anything that's going to elevate the toes. But from this position, what we want to do is try to drive the knee as far forward as possible so we can get into maximum dorsiflexion of the ankle. But this is the myofascial stretching exercise for the soleus muscle. For the S1, S2 ELDOA, we're going to go ahead and get into a supine position, meaning you're going to be laying down on your back and you want your shoulders and head elevated. You're going to take your hands, grab a hold of the inside of your shins at the ankles, dorsiflexion of the ankle by pointing the toes toward your head, eversion of the ankle by pointing the soles of your feet away from each other, and then we want to maintain the retroversion of the pelvis, flat lumbar, flat thoracic, chin tucked in, crown head away, as if down between your thighs to put the dura mater in tension. We want to be supported on the S2. From here, we want to go ahead and unroll the spine until the base of the skull touches. As soon as the base of the skull touches, the S2 is going to lift up off the ground. Principle of action, we want to press the S1 down into the ground, the coccyx we're pushing away from our body. At the mouth, we want to activate the buccopharyngeal fascia by swallowing. When we swallow, the tongue should get stuck up against the roof of the mouth, and you want to maintain it against the teeth. And this is the S1, S2 ELDOA.